I am the doctor. The struggle for respect as a Black woman in medicine. So, this is particularly for Black women who are physicians, particularly for you. However, this is for any Black woman, honestly, because you will see in this conversation that there's so many parallels. It doesn't matter what profession you're in, it doesn't matter where you are in the country or in the world. There are going to be some parallels that you will hear today, but there might be some specific focus that is on Black women physicians. So thank you so much for watching today. Thank you for joining. And I'm so excited to have one of my Spelman sisters here today with us to have this very lively conversation about the experiences of Black women in medicine. So I'm going to turn it over to my Spelman sister, Dr. Ayana Herbert, for her to introduce herself.
Hi, everyone on YouTube and anywhere else you're catching this live. My name is Dr. Ayana, or Dr. Ayana Herbert, Dr. H, whatever you want to call me. I am a board-certified emergency medicine physician who is beginning to pivot into lifestyle medicine. I am doing this for now over 20 years in that field, and now I'm moving over into the other side of medicine, and we're probably going to talk about some of those reasons today. I am the owner and founder of Path Health in Atlanta, Georgia, where we focus on medical weight loss and bioidentical hormone replacement therapy, as well as offering adjunct services such as IV therapy, IM therapy, and that's just going to grow, and I'm excited to be here.
I'm so excited to have you. Okay, so we're gonna talk about what Dr. Herbert has to offer a little later in the conversation. So please stay tuned so you can learn more about services that she offers and how she can be contacted. So Dr. Herbert, can we start with experiences that you've had in which, as a medical doctor, that you have experienced disrespect? What does that look like for you?
So it goes through the career, and it doesn't always have to be overt. That's what I'll say. I do have a little bit of an advantage in working in Atlanta in terms of knowing what different diverse demographics look like. But I can say I'm still in the South. And what I mean by that, you go a little bit south, there's hospitals I worked at where they still would refer to you as colored. They'll be like, all these colored doctors and nurses, if they were, not obviously Black, saying something like that,
Wow.
and
Color.
wanting
They'll
to
call you color.
refuse, yes,
Ooh, wow.
we are
Okay.
still in the South, and wanting to refuse care because of who you are. Another version of that to me is just when you can introduce yourself. We had to get to the point where we had big, bold badges that have to say the word doctor. You walk in, my name is Dr. Herbert. You do all the things, you do all the parts of the examination, and you still get the question, so when am I going to see my doctor? So that happens more than, I would say, for every Black female physician out there. If we had $1 for every time that happened, there would be no more Black female physicians because we all would retire on that. So I just say that to say that it definitely happens. And when I say it could be covert, sometimes just that they won't look you in the eye. You can tell that they don't trust what you're saying, or they want another option. Is there anyone else that can see me? I'm like, nope, I'm it. Oftentimes when it's single coverage and I'm the only attending on, I am the option. When you want to speak to my boss, that's me. You can talk to me. So it definitely occurs. It's not every patient. Thankfully, with certain demographics, it's balanced by that person who appreciates who they see walk into that room. So you're able to find the balance through an entire ER shift, or I would say even through your career in the different locations and places that you may work.
Wow. Oh my God. So the blatant, like, are you the doctor? I'm waiting for the doctor. Can I get another doctor? Do they specify or say why they want another doctor? Do they say why?
Not, I wouldn't say directly. No one's going to say, I want a white male doctor, please. It's just, is there another option or choice? Or sometimes you could even just tell that the information, if I do bring another colleague into the room, that it is received, even if they say the exact same thing that I just said. So that's something that, sometimes you have that about like a change of shift or something along those lines, where the receptiveness could be different in terms of what, you may have just explained just as well. just as plainly to a level of understanding, but sometimes it coming from someone else makes it more received or
Wow.
receptive. So I can say that definitely has happened.
Yeah, and I see two comments in the chat. This has happened to me more times than I can count. It's also a
Mhm.
problem when you introduce yourself as doctor and they call you miss.
Oh yeah. May I call you? No, you may not. And you have to be able to speak up and feel
Boundary.
comfortable, say it with a quick smile on your face, and and keep going. But that
Hmm.
definitely does happen where it's a miss, and I just don't think that happens to men in general, probably in medicine. And then if we want to apply, you have the gender issue as well as race as well in terms of
Hmm.
perception. But yeah,
Hmm.
or just and nurse, and that's not a slight on nurses are an
Right.
important part of the
Yeah,
medical team. So when we as Black women physicians say, like, the assumption is that you're a nurse, we're not saying there's anything wrong with being a
absolutely.
nurse. It's just
Right.
that, why is that the assumption that
Right.
is the highest level that we will ascend in medicine? We're doing all the things. We're nurses, we're nurse practitioners, we're physician
Hmm.
assistants, we're doctors, we're CEOs, we're all the things. And so
Hmm.
just, like I said, why the assumption is made that that's all, that if you see a Black woman in the medical setting, that it's a nurse. Or even worse, it could be all kind of other roles. And again, nothing negative with any of those roles. We're all part of a team. It's the
Hmm.
assumption.
Right. So the assumption, and even when you clarify, okay, that was a misassumption. No, I am the doctor here. They still double down with that. They still
Sometimes,
double down with that. Yes.
sometimes it's like, there's just this block or this filter in the
Hmm.
ear that just doesn't get undone in that small moment.
Yeah, yeah, and I see another comment. Another problem is when you see a patient with a white nurse and they only make contact with the nurse. So
Hmm.
it's like the blatant, but it's kind of like the slights too. So
Hmm.
these are happening with patients. What about experiences that you might have of disrespect just in the medical field who are not patients? Maybe other medical professionals.
I would say sometimes, and this just could be people being just bad people in general, because a
Hmm.
lot of times, especially in the ER, we're talking to people over the phone,
Hmm.
like when we're talking to consultants. And
Hmm.
so I would say there's definitely a dynamic gender. I can get talked to all kind of ways when I'm oftentimes talking to a male consultant.
Hmm.
And you give a full presentation, and one that was really rude, I dumbed myself all the way down. And when I say that, I meant I presented like I was a new student. I gave him every period, dot, and he's like,
So
that's
you're
enough.
going up and above, up and
I was
above.
like, I shouldn't have to tell you all that. I'm the
Right.
physician. I've made my assessment. I've made my diagnosis. It
Hmm.
requires your assistance. You can come see the patient. That needs to be the conversation. But
Right.
they'll question, and to me, they are questioning you. And I'm going to be honest. I think our voices are distinctive to a certain point over the
Hmm.
phone, whether you see my face or not. And
Hmm.
we're going to talk about gender first. But I think there could be a little hint of, what do I know what I'm talking about, even on a phone conversation.
Wow.
As far as so there, and I will say that a lot of consultants are very dismissive. Again, sometimes that's specialty dependent and it's not
Mhm.
necessarily a gender or a race issue, but the dynamic can still be there, and it's sometimes hard to differentiate.
Got it. Can you elaborate a little bit more on it being specialty specific?
Surgery. Specialist, who don't want to be inconvenienced for what came to the door. And I will say this too, and for anyone who works in underserved areas,
Hmm.
like if it's a question of who they're being inconvenienced for, sometimes that comes into the conversation. Is this person insured? The person has this diagnosis, they need this treatment.
They're talking about the insurance status?
Sometimes that comes
Wow.
up, where, you know, that's what they're more concerned about than the patient themselves or the diagnosis. In the end, as ER physicians, we're the ones who are in front of the patients and need to
Hmm.
advocate for the patients at all times. And until the consultant, by our request, comes in bedside to see that patient,
Hmm.
it's the ball's in our court, so that's, that. So, but yeah, sometimes I feel like there's this little filter of questions that kind of are prejudging the patient sometimes.
Wow. Wow. And I see someone is in agreement with you. You have to shut them down sometimes, especially the surgeons.
Yeah, especially the surgeons.
Especially the surgeons. And so you're talking about the experiences that you've had, and I'm assuming that, we're in a network of other Black women who have a similar profession. So is this something that you hear from your Black women colleagues as well?
Yeah, and I'll speak. I'm fortunate to be a part of private like Facebook groups, that are compiled of all Black female physicians of all specialties,
Hmm.
all training, all residencies, some international. So we're able to come together and have a safe space where we can talk about really everything. But sometimes we get to talking about the microaggressions that we have, or encounters with consultants, or sometimes encounters with sometimes racist patients. So we can come, tell those stories, have the safe space, share our experiences. And so that's been an invaluable group. Sometimes you might just be someone who's
Or
not, listening, maybe not commenting, maybe it's not your story, but in the end, it's all of our stories.
yeah.
So, just having that space. So we have a broader group, and they have some that are broken down into different geographic areas, one that's
Hmm.
specific to Atlanta.
Hmm.
And then what's nice too is there's one other group. It's called Atlanta White Coats and Gavels. It was started by Dr. Barbara Joy, and that's lawyers and doctors together.
Oh,
Black.
okay.
So we also bounce things off each other between legal and medical, and sometimes those are medical legal conversations that we're able to have amongst each other to keep us, accountable, keep us supporting one another, and just surviving and navigating. So yeah.
Yeah, that is so important. I'm glad you have that community because we heal in community. And a lot of times when you have these experiences, again, across professions, and you just said it could be across specialty, it could be all these different things, but we see all these parallels. So then we feel like we're not alone. We
Mhm.
feel like we have a sense of validation. And then we're in community where we could talk to other Black women who might be having similar experiences. So I'm glad you have that. So can you talk about, you mentioned about sometimes based upon insurance status or issues with maybe surgeons, there might be more kind of more static, more issues. Can you share about a specific incident where you had to really like assert yourself because a surgeon or someone else was just very demeaning and disrespecting you? You talked about like having to like kind of dumb down and kind of, like make sure everything was exactly right. Can
Mhm.
you give us a specific incident where you really had to go hard and advocate because they were demeaning you in such a way?
There's one, it was a neurosurgeon, so the word surgeon is still there, which is a very, very specialized area of medicine. And you have a patient, they're symptomatic, there's something wrong, and you get the CT report and it has all these long words that even as a seasoned doctor, that I'm like, I don't even know what that is. I have to go into my neuroanatomy and figure it out. There's clearly a problem. And this person said, that's asinine, like using that type of language over the phone. I saved that chart to the end of I saved that chart for years because I was like, this is going to come up. I don't know how it's going to come up, but the conversation, thankfully, conversations on hospital phones are recorded. So,
Oh, excellent.
and you got to keep your cool. You can't
Yes,
drop to their level. Just like Michelle
yes,
Obama said,
right.
oh
Even
my
though
God,
they do
you got
things
to stay high. You have to stay
make
professional.
us infuriated, right? But we always have to absolutely remain composed. Yes.
Yeah, but like why are you calling me in the middle of the night? But this is, I was like, only you know that because these are neurosurgical words. That's your specialty. So this is why I'm calling you. So I will disturb you. And if
Yeah.
you professionally can say it's safe to send that patient home, one, I'm not going to do it. I'm going to find at that point you don't even want that patient to be cared for by that
Mhm.
specialist
That's
because
scary, right?
you have a certain thing that you're giving to that patient. And then it's sometimes scary to know that the next person in line for that patient's care is someone who not only treated me like that as a colleague and a professional, but how are they going to regard that patient? But you'll see them switch. They'll talk to you some kind of way on the phone, but they'll come down to the ER like, hi, patient,
Oh
and like,
my gosh. You know the real deal. And what you said, I really appreciate that, is knowing who they really are. And
Mhm.
they're coming down pretending to be somebody that they're not. And some level of fear of, is this going to interfere with their medical treatment of someone if they're talking, if you know
Potentially
their true
100%.
attitude about them?
Oh yeah, we know that those disparities can affect outcomes. We already know that. So yes.
Yeah. Yeah. Can you speak a little bit more about, because we're talking about medical racism, can you talk a little bit more about medical racism and ways that patients can be empowered? Like if they get a sense, like a doctor is kind of like racist, like, I don't know, like even if the doctor asks like everything's okay, like, you know how Black people, we kind of sense that something's off,
Mhm.
right? If we
Mhm.
get the sense like, I don't know, I don't really like this doctor. I don't trust this doctor. I'm about to have surgery. I don't trust this doctor. What
I
would
would
you say?
say always advocate for yourself. You have to be an advocate. If you can have a family member or a loved one that can also
Um,
advocate for you, you can refuse care that can also sometimes be looked down upon from, again, the physician standpoint. When you do advocate, it's inconvenient. Now we got to go through this, but there are kind of ways to kind of keep going up the ladder to get to the right person, and including getting all the way up to the C-suite. But you should be able to choose your physician. Unfortunately, the way that healthcare is, a lot of times you just don't have those choices, right? You
yeah.
have who you have. There's not options. Also, the ability to reschedule, the ability to request is just very limited. Then you're pushing your problem further out. Then your
Um,
condition can potentially get worse.
right.
In that effort to advocate for yourself. So it's a little bit of a rock and a hard place,
Yeah.
depending on what type of access to care that you do or do not have, and what those
Hmm.
choices are. If it's really a true specialist, then that can
Hmm.
be limited in the number of physicians. And to me, you don't necessarily have the physician of color to have one who is truly empathetic and
Hmm.
highly skilled and will
Hmm.
take care of you the way every person deserves to be treated. But
Hmm.
sometimes you just don't know that.
Yeah.
Um, yeah. So
Yeah. And can you talk just a little bit about what would be the protocol for saying, I don't want this doctor, and kind of escalating it up? What would, how would someone do that?
I mean, I would say in the ER setting, it's tough, but you probably would start by asking for like the nursing supervisor of the department, more so than because they're going to be the ones who have that time to kind of go up the ladder while, physicians are still actively taking care of numbers of, people. So
Mhm.
they oftentimes will act as liaison between physicians and ourselves. I mean, physicians and whatever the next step is.
Mhm.
Like I said, I'm speaking from an ER perspective. If someone's on the floor,
Mhm.
it just depends. Staffing is a big issue. We're talking about toxic environments in
Yeah.
healthcare,
Yeah.
right? So sometimes, again, there's not a lot of options. So even if you go through all the steps, but I would say oftentimes a nurse manager, a nurse supervisor is the person that can advocate. But every department also has a medical director as
Mhm.
well. So
Okay.
sometimes that call, even if a nurse manager or supervisor is assisting those connections or communication, has to kind of go up that, because like I said, if we're on shift, we still have to work and do our job. So it has to go into, like I said, board of directors, medical directors, those people exist. And a lot of them, take call for these type of problems.
Mhm.
Thankfully, they don't happen often, but there
Yeah.
should be a system in place to get to the person above, the physician group.
Yeah, so there is recourse. So if we get a sense that something's off, right, I think it's important to,
Yeah,
like,
you can
not
write it, you
emerge.
can report it, depending on how it's handled and the
Uh-huh.
review and the way that hospital administration handle it. They could bury it or they can address it. They can go all the way up to technically the state medical board if it's an
Wow.
extreme enough case. So you definitely would have to have, I would say, good documentation. Now, we don't want you in there filming us, taking 1,000
Look at
notes,
TikTok,
and posting us on
IG
TikTok,
video.
Facebook, that's really
Yeah.
a lot of times policies don't allow that. But still, you can document things if they're going wrong. I would say document it when things happen. When I see stuff go wrong, I'm gonna write that down for you. When I see things that are going wrong, I'll help them advocate for themselves. I was like, no, that is wrong, and you should write it, and you should go report, and you should go complain. I don't
Hmm.
think there's a reason that patients should just tolerate things just because they're in a vulnerable position as a patient.
Yeah. Yeah. I just thought of another question. Have you ever had an experience where you are being disrespected in front of a patient who, let's say, who's Black,
Mhm.
right? And they see what's happening to you? Has that
Mm,
ever happened to you?
I can't say off the top of my head. Just
Okay.
there's not anything that stands out. Now I've been doing this for a long time, so the answer
Yeah.
is probably yes.
Yes.
But
Yes.
I can't. There's no one story that I'm pulling out in that case. I mean, I feel like there was. Okay, maybe there's one.
Okay,
I
okay.
think it was a delivery, a baby's delivery, and we were having trouble with the placenta,
Mhm.
delivering the placenta in the emergency room. Of course, we have OB called. Time is passing while they're taking their time coming to see the
It's
patient.
emergency.
So by the time they get there, oh, look, magically the placenta's delivered. So they're like, why'd you call me for? And so I'm like, so but
Wow.
those kind of conversations taking place right in front of the patient. I'm just like, yo, I continue to do my job is what
Yeah.
happened here while you refused
I
to
can't
come.
just wait.
This is someone who refused to come in initially, So it's those kind of things, and sometimes those things because you're actively taking care of a patient bedside, and a doctor
Yeah.
comes in and they're also their bedside. That sometimes those little conversations can happen, but I would say not terribly often in
Okay.
those scenarios.
You know what? That's scary what you just said. That is really scary that a doctor refuses to come in to help.
Well, sometimes
You
as ER docs, they kind of, I want to say, kind of tell you to do their job for them. Even though we are there for emergencies and to patch the holes and do all the things, there's this point where the patient would be better served by the
Mhm.
specialist. And
Right.
instead of them coming in, they pull us out of our scope and out of the lane that, some people are, cavalier and they'll do anything, MacGyver, everything. But
Mhm.
just standard of care, there's a point where a specialist should be taking over the care once we have
True.
stabilized the patient. And so
True.
instead of coming in, they'll be like, okay, just do this, grab this clamp, do this. I'm like, hold up. I'll do
Wow.
it. I'm not scared, but that's not.
Yeah. So
Yeah.
different levels of setting professional boundaries.
Mm-hmm.
Yeah.
You
I see
have
another
to.
comment came in. I've had to not so gently remind a surgeon that his yelling, I guess in the ER, was not acceptable, and he will respect the nurses, yet not the patient himself. So yeah, basically disrespecting her in front of everybody,
Yeah.
just out and out disrespecting. So you talked about having these communities. You talked about having other Black women that you talk to. How do you all navigate these blatant and then the less blatant but just very disrespectful behaviors towards you all? How do you all navigate these systems?
I mean, yeah. I mean, like I said, in that setting, you gotta let it roll off, honestly. But that rolling off, there's a part of that roll off that you absorb over time.
Mhm.
That's how I look at it. I would definitely say that I'm fortunate. Once again, I'm in Atlanta, so sometimes I can show up to a shift and it's all of it. It's diva night, all the
I love
queens
that.
are Black
Uh-huh.
female. We call it diva night, and so we're gonna roll off. We know
Yeah.
that we're doing the right thing for our patients. We know that we're giving excellent care to our patients in the moments that we're in control of that situation. What
Mhm.
happens after that, once again, what I do love, like I said, I've been doing this for 20 years, and
Mhm.
so we also support each other outside. Our careers go in different directions. We don't always stay where we are. But there's a group of physicians that we stay in touch and we get together, just to vent, talk about life, talk about our hobbies. You got to balance it all out. I will say
Yeah.
that in ways
Yeah.
that we do with it. I'm gonna give a quick shout out to a few of those ladies. So Tanya Callahan, Jen Berman, Bernetta Harris, Bernada Norwood, Michelle Juan. These are ladies that we've been. Alice Frey is out there, Angie Harris. We've been doing this for a long time, holding it down in Atlanta in various emergency room settings. And like I said, we keep in touch outside the department because we know what we're going through. We know the settings that we're dealing with, but we know it's important for us to be in front of these demographics with the
Yeah.
empathy that we have and the way that we advocate for our patients.
Yes. First of all, that's dope. That is so amazing that you have a community that not only to talk about work things, but more like work-life balance, that there's more to life than always working, which is so important. And I love that you called them out. So having that sister support, and we're going to talk about this soon about sisterhood and Spelman and all that.
I can't forget
So,
Tiencia. I got to throw her out there. She does Ironmans.
oh,
She finds major balance.
wow.
She's
Okay.
a rock
Okay.
star.
That is amazing. And you called it what, Diva Nights?
ED Divas, Diva Nights, when we all show
Oh,
up. Like, we're all in different places now, but there was a peak in time where we were, like I said, we were all there. Like, it was just,
that's
we would all be
amazing.
on the schedule at the same time. And those
I
were
would
fun.
have loved to see if I had to go to the hospital, I would love to see all Black women in action. That would be
Uh-huh.
so magical to see that. But you also talked about absorbing some of it. You said some of it you kind of have to just deal with it, right? Because you're doing your job, you're like on the go. And I think a lot of us across professions, we've had these slights to us and these
Mhm.
attacks, and we got to keep moving because we got to keep doing our job. But you
Yeah.
said some of that absorbs. Can you
Yeah.
talk about the
I don't
absorption?
think I don't think it's a conscious thing that we know. You know what I'm saying? It takes a toll in time where I will say for myself, even though I know how important it is for me to continue to operate in that setting, you just
Mhm,
can't anymore. You
mhm,
know, it
mhm,
becomes hard to be in certain settings. Not always, like I said, the overt. It's not always overt in terms of racism or gender issues. The other part of it, and I'll speak to my own experience coming from
mhm.
Spelman, I trained at Charles R. Drew University with
Okay.
UCLA. That is where you're dedicated to serving underserved populations. We are more likely as Black women to also practice in these settings, and we're needed in these settings. There's a way that we're going to advocate. There's those extra couple minutes, that extra little thing that we're going to say that could change
Mhm,
the health trajectory of someone's life. But
mhm,
those healthcare systems that we work in subsequently are also going to take a toll. It's going to be poorly supported, poorly funded.
mm.
Operations are going, and all that affects us. In addition to the things that could seem very overt,
Yeah.
in terms of the environments that we're expected to just tolerate, and
Mhm,
sometimes lower pay on top of that. Just to say that we are, doing the altruistic thing that we were called to do, and
yeah.
and just to, and that's kind of what I mean. It's like that
Mhm.
those environments slowly, I would say slowly, because when you're younger, you can kind of take more. You've been in it a longer time, it starts becoming heavy. I
Yeah.
would work night shifts and I would take
Ooh.
a nap. I'll wake up, and toward the latter part of the one place that I worked at for almost 18 years, I started to feel a heaviness and a dread for going to work.
Ooh.
But that was
Ooh.
operations. It's never about that interaction one on one with my patient. It's everything else.
Yes.
We're
The
always
drama.
expected to stay in these roles, to not look
Yes.
for other options that are better for our mental health, our work-life balance, and those type of things.
Okay, you said so many different things. We gotta, we gotta go deeper because I was like, OMG, she is speaking exactly to things I've been thinking about a lot. One is no longer operating in the system. So the challenge of I love the work, but the drama here is draining me to the point I'm starting to dread it.
Mhm.
And the part that I think so many Black women that I hear from so many Black women, and even I experience it as a toxic job survivor, is recognizing that, but also not even perceiving that
Mhm.
leaving was an option. Not,
Mhm.
not even seeing it as an option.
Yeah.
To
We're
me,
we're we're too loyal.
and we're fighters, right? Like
Fighters,
what?
we're
We're not going,
loyal.
what? We're fighters, we're
Mhm.
loyal, we're dedicated to work. And so I didn't even conceive like I can leave this place and do much better. I can
Mhm.
leave this place and be healthier.
Mhm.
Didn't even conceive of it at all, right? And that's exactly why Marissa and I are doing the Job Liberation Virtual Summit for Black Women. Going across the screen, everybody. Okay. So the waiting list is open. I'll talk a little bit more about it later. But that was part of the reason why we did that because both of us are toxic job survivors. And
Mhm.
both of us, when we were in the job, until it broke us down,
Mhm.
literally broke us down, we could not envision leaving the job. And I'm like, what is that about? Right. And that's part of the fascination for me as a psychologist, because I go to these meetings and these conferences with brilliant
Mhm.
black women, right? And they're talking about horrible stuff happened to the job. The job is breaking them down and blah, blah. And I'm in these meetings, I'm listening to them talk, which is heartbreaking. And their focus is on how do I cope in this environment
Mhm.
so that I could stick it out because I'm not going to let them run me out of here. Or this is such a good job that I've gotten to this level, right?
Yep.
The got on promotions,
Yep.
all the things. I'm not going to leave. And so that's the part I'm like, oh, sis, there's another option.
There's
The
always,
option
there's
is
always,
take
there's
your
always,
and go.
there's always other options. A lot of
Yeah.
physicians are taking control of their careers now in that way. Like I said, where I was for 18 years, and I backed out. Like, one, I'm a Scorpio, loyal, all the good trait that could just be a curse too.
Yes.
And then you still have your colleagues that you've been there with for 10 years. So it's like, okay, now you're working with friends and all that. And so I did it slow. I was like, okay, let me do a leave of absence and
I
see
get too.
and
Yes.
see how I feel.
Yeah.
I'm gonna make up for my hours over here. But what I say to this day, I was like, chest pain is chest pain.
Oh, you having chest pains?
No. I'm saying, like, what people come in for. Medicine is medicine. I think this is what I mean. And I did have part-time other jobs. I said, I don't feel that way when I'm at job B and job C. I only feel that way when I'm here. Chest pain is the same there. And my workup, me as a doctor, my acumen, all that is the same. So why, when I wake up to go to this job over here, I have this feeling? And I had to evaluate that. So I took a leave of absence. I took a 6-month leave of absence, and for a physician, that could be a significant drop in income if you don't have a way to make up for that. But I had to, for my mental health, depression, anxiety, all that stuff was setting in. It was affecting other things, spilling over into just every other aspect you can think of your life.
Girl, yes. All of that.
And so with that, when the 6 months came around, I was like, can I extend that? And I extended it. And I was like, well, let me get my ducks in a row. I used the extension to just get my ducks in a row, like, crossing over insurance and making sure I was good in that transition. And there was no pizza party. There was no going. I just never went back. And I definitely, missed some of my colleagues. But what was happening is, while I was gone, they were slowly leaving too. I was like, if y'all leaving, what am I coming back for?
Right.
They're finding their balance and kind of getting out of the environment. And I had wonderful colleagues. There was never really about my colleagues. I will say, where a lot of my colleagues they trained in diversity. They trained with that empathy. They did serve that demographic very well. I'm just like, how do y'all do it? Some that was their home, and they're still trucking along there, and I commend. I just personally, I was suffering. My performance was suffering too, and that's another thing. Metrics showed it, and I didn't care. That was the thing. It wasn't that I didn't care about the patients. I didn't care about chasing the numbers and all the corporate stuff. Like, I was like, I'll just be at the bottom of the barrel. I didn't care. I didn't care to be better in that setting.
Yeah, was it like productivity numbers or something like that? Did you all have that too?
It was that. I wasn't doing the paradigm shift, but I didn't. There was no drive in that setting to do so. Other places I could go see 24 patients, no problem, because their systems are in place. And so, or their staffing is in place. Like, the operations work, then I can work. So I just had to find something that was better for me. Like I said, I can't speak to the other docs that are still working there and making that place do what it does. But I had to sit back and say what was the best thing for me, and take control of my life, my mental health, get that back on track, going through, little therapy, cognitive behavioral stuff, all of it, I'm saying, that had to be done to get me there, and to say it's okay to leave a job of 18 years. It's okay.
Absolutely. Giving ourselves permissions. Okay. So I have to reflect on a number of things you said, I want to also reflect on ways that my experience resonated with yours. One was when you recognize you're starting to have symptoms, right? You were like, wait a minute, I don't feel that other places, right? So the importance of us as Black women to pause. I always say pause, because we're always so busy. Like, girl, I'm too busy to be thinking about that. I'm too busy. That is a trauma response. So we have to pause and say, wait a minute, what's going on? Why do I feel this way? And what is contributing to why I feel this way? If we're able to identify it's that job, if it's not other stuff, it's that job, then we need to pay attention. The other thing, what I heard you say is, you paid attention, you took a leave of absence. That is exactly what I did. Mine was a straight year, because I was like, I'm not coming back, right? I was like, okay, I got a year. I got to get my exit plan together. I got to get out this place, because I'm not coming back here. But giving ourselves permission to take a leave of absence, and I think part of it's the mindset shift of, you're doing this for yourself. You're doing this for your own health and your sanity and all those things. It's not, oh, I don't want them to think that I'm this. Like, we got to get away from that, because it's like, who does that benefit for us to do that, right? You took the leave of absence. The other thing was, you started planning. You started like looking at, okay, what are my options? What do I need to do? And all those things are so important for us, because I think, and what I'm hearing from so many Black women again, which is really breaks my heart. When I hear Black women, again, that sentiment I said to you earlier, they're not gonna run me out of here. I've been here 18 years. I'm not going nowhere. I got too much invested here. They're not gonna run me. All that's I was there 13 years. And again, you're still in your mind like, wait a minute, no, no, no. I'm gonna try to find a way to make this work. But what I encourage Black women to say, okay, look, there really are other options for us to replace our income. So many of us think, even though you're a medical doctor, I'm a psychologist, right? I'm thinking, oh wait, I can't leave because what am I gonna do? How am I gonna make money? What? I was licensed before I even got the job, right? You were like, you had all the skills, but again, that mindset, I cannot leave. And so I love what you're saying, because I want Black women to know, not just for me, not for what I'm saying, that you really can replace your income. There really are other options for us to replace our income, but we have to be honest with ourselves, because I think many of us as Black women, we lie to ourselves. I got this. It's not that bad. I'm just going to take a vacation and I'll feel better. Oh, maybe I'll get some more shoes. Maybe I'll feel better.
Some retail therapy.
Right. All these things are band-aids. Or I'll go to therapy, which is important. Therapy is
or that you find yourself counting every hour of the day that goes by and you're surviving instead of thriving in that time period. And that's a big one for me, because that's what I'm like, looking at the clock. And it's sometimes in our careers, like you said, when you're talking about 13 years, myself, 18 years, I mean, you're at that little age where it's like, you're not old enough to retire yet. You still got to make it another 10, 15, 20 years. And are you going to be counting that down the whole time? You know, or play the lotto, and we know the probability of that. So I look at it as like that at an inventory, it's like life is too short, but the track to retirement is too long. So you have to like, there's that point where it's like, it's not just like, oh, I just got 2 more years left. Let me just tough this out. No, we got a while, you know?
We got a while, right. And the thing about it too is the quality of your life. So you can stick it out, looking at every minute at the job, being miserable. A lot of women watch this right now, experiencing the Sunday scaries. They're dreading going to work tomorrow. You can choose that. You can choose that. You can choose to be in environments where you continue to be sick. You can choose that. But I also want Black women, there's another way, right? Why do you think it is for so many Black women, so many of us, believe there's no other way? We just believe that we got to stay there, right? So we talked about the golden handcuffs, right? The money. We talk about, well, I can't just retire, right? All these things. Can you talk about other things maybe we haven't talked about that may keep us in toxic work environments and not perceive, not even imagine, not even consider the option of leaving? Like, I don't think about that. Right. And I want to say that too, because I heard something last week on a live. And my guest, it was Dr. O, and she said, you know what? Some days I couldn't even watch her videos. I couldn't even watch her videos because I could not come to terms, and I couldn't be real with myself that I was in a toxic job. And now that I have the realization, what am I going to do about it? So I just avoided watching your videos. Right. And so the avoidance doesn't help us. But I'm just curious about other reasons why you think that we as Black women don't even consider the possibility.
I'm going to just throw one out there. Okay. I would think as Black women, I'm going to speak for physicians, and you're a high income earner in your family, so much is relying on you. And you don't want to introduce that instability into your personal life. So whether it's in a relationship, whether you're married, whether you have children in your life they're responsible for. Me personally, I'm not married. I don't have kids, but I have nieces and nephews that rely on me, that I help out with some of their activities and things like that. And if I become unstable, what happens to, it's like oftentimes it's the roles that we have in taking care of so many other people in our lives that can, I would say that can potentially, I'm not saying it is for everyone, but I can see that potentially being a factor is it's a disruptor, it's a destabilizer, and we're oftentimes the foundation of a lot of things in our lives. The other thing we talked about, kind of being the over loyal, in our personality sometimes as Black women. But that, if I were to add something to that conversation, I would say that, like I said, especially if you're in a high earning position, depending on your dynamic personally and how many people are relying on you. And then also just understanding what support you would get to be, temporary unemployed or between jobs, or to be pursuing something else, to go back to school. We have to think about what our support systems look like outside of the role that everyone's just so used to you being and doing.
Yeah. So I want to speak to a few things. And I see Dr. Prim is in the house. So Dr. Prim, I met her through All Healers Alliance, which helps Black communities in crisis response. So Dr. Prim said, we are taught by our families and culturally to stick it out, but sometimes we have to leave for our well-being. So true, so true. And the fear of the unknown is a big one, right?
That's why people stay in relationships too.
You said what?
That's why people stay in toxic relationships. And this is a working relationship. It's not too much different.
It's so true, so true. I actually did a video about why is it okay when we tell people, when we see that they're like an abusive relationship or a relationship that's not serving them, we support them and say, you need to leave, right? That's not healthy for you. But when we know that people are in an abusive work relationship or job that's not serving them anymore, we don't tell them to leave. We tell them, girl, all jobs are toxic. Girl, you gotta find a way to deal with that. You can't let those people get to you. Can you speak to that? The fear and people around us telling us to stay in toxic work environments or jobs that are not serving us.
I'll say like the fear of the unknown is probably what you're touching on. Being able to lateralize into the same income bracket, depending on what that is. The fear of needing new education, needing new skills so you get comfortable, right?
Yeah.
So the not wanting to be uncomfortable in order to make the necessary transition. And sometimes transitions require new skills, new work, new attitudes, and definitely new mindset, right? So if you're not, it's going to take that. It's not just necessarily going to fall on your lap. And so I think it's learning to be uncomfortable with that. What will be temporary discomfort, I think we have to understand that normally transition is just that, it's temporary. And if you can accept that and, have some clarity in what you're trying to manifest, then, then you will have that faith to kind of go for it. But I would say that's a lot easier said than done.
It is.
We can say it.
It is.
We're clocking in the same.
Yes, we can say it, but I think it's important to name it, right? So the fear of the unknown. And when I talk to people, and I'm very transparent about, I had a really hard time leaving that toxic job, even though it was horrible, right? Because of the fear of the unknown. And so in therapy, I had to work through, the fear is going to be there, right? Because we don't know exactly what's going to happen. Like I'm putting things in place that would increase the likelihood that something bad will happen because I'm generating income, right? So that's why I try to teach Black women about different ways to generate that replacement income so you can address that fear. But there's going to be other fears. And so for us to be honest, the fear is going to be there. The fear is going to be there. So don't let that stop you from moving forward. I would say, let's use that fear. Let's channel it to get prepared and get the resources and get the exit plan together. Because I never tell Black women, just leave. No, just leave. I don't tell Black women that. Unless you're in immediate danger. You're about to have a breakdown, you're really sick. Yes. Other than that, I always talk to Black women about, let's prepare to leave. Let's come up with an exit strategy. How do you prepare to leave, right? But the fear is going to be there. So I don't want Black women to say, well, I still feel the fear. That must mean I need to stay. No. The fear, it's a fear of change. Change is not easy. There's always some level of uncertainty and fear, but we still got to move forward. So I see some comments. Yeah, people saying you don't lead a good job, right? That was my mother, right? Go to lead a good job. What are you doing? That's a good government job. You better lead a job, right? Projecting all the fears onto me. And I had to say, you know what? I cannot talk to her about this. I can't talk to her about this because she will have me stay at this job that is harming me. So I have to do what's best for me and my family. I cannot do that. So we have to be mindful too as we are transitioning out or we're making those moves, we're exit planning, check your circle. Okay. So if you have a circle of supportive people, Dr. Herbert, you talked about your supportive network, right? Be mindful of what information you share with people, particularly when you know they're going to project their fears onto you. Not a good idea, right? I see another comment. I have a coworker, and she just came back from leave from grieving the loss of her son. Has 24 years in the role, and also has a chronic health issue. She doesn't want to leave, but she has a support. But she has support from her husband. I told her to explore the option. That's good advice, right? My also hope is that she is open, right? Open to looking at resources. I did a video recently about for many of us as Black women, this is me, right? I was so close, right, closed hands, right? Like, no, I know I gotta stay and fight these people, right? As opposed to being open, like, okay, God, I get it. You trying to tell me to get out of here. I get all the signs, I get it. So as opposed to being open, and when I left, when I decided to leave and I actually resigned, when my hands were open, so many opportunities came to me that I never, ever, ever could have imagined, right? So as we think about, being in these work environments, thinking about moving forward, knowing the value of our worth and knowing really kind of like knowing our greatness, right? So this is my transition to talking about us as Spelman alum, right? So again, this is not an advertisement for Spelman, even though we are Spelman
It's
alum.
an advertisement.
It might be. Okay. So when I talk about my experiences at Spelman, truly that changed my life. That truly changed my life. Like that was the first place as a Black woman that I felt my worth as a Black woman and felt that people not only supported my growth on so many levels, but they challenged me to go further, right? And they also taught me that we're standing on the shoulders of our ancestors, the importance of giving back. That's why my business is lifting as we climb, because I learned about that at Spelman. But the other thing was, I was poured into so much at Spelman that when I went out into the workplace and I experienced racism, well, I experienced racism all my life, but when I went out into the world, right, the professional world, and experienced so much racism and sexism, even as a psychologist, people questioning, "Are you a psychologist?" Right? The whole thing that helped me. I had that like that psychological grounding, and I remember our graduation speaker was Oprah Winfrey, right? And she said, and I always remember this, she said, as you go out in the world, people are going to treat you like a slave girl, but you remember you're a queen girl. I remember that so many times because when I was at that toxic job and they were straight up trying to teach me like a slave girl, you stay in your place, you better, who are you, all that kind of stuff, right? I was like, what? Like who are you talking to? Like I know who I am. Thank God for that. So that sense of grounding, right? And also my family poured into me too. But having that grounding, I think really helped me survive because I don't think if I didn't have that grounding, I think they would have broke me. I think they would have, right? So can you talk about, as a Spelman alum, a proud Spelman alum, how do you feel that Spelman experience has helped you?
So I would definitely agree with that. I'm going to get a shout out to class of 97, Notorious 97, of course, as I go into this. But what it does, and I will say in any setting, I am unapologetically me. I don't care. It
Right.
allows that because we know who we are. We know what we're fully capable of. We're
Yes.
surrounded in our peer group, friends, acquaintances, reunions, home, you name it. We know what we're about. We know what we achieved. We know what grad schools we're in. We know what we know. We
Yes.
know what we're capable of, and you can't take that from us. You just can't. And
Mm-mm.
so I think we're just empowered in that way. Like I said, to show up, to have a certain confidence in our education, our foundation, And then you have rocks, you have support when it does get hard.
Mm-hmm.
You have that sisterhood to turn into. Those,
Yeah.
People always say, for Spelman, like it's the best decision, that they made.
Ever.
Can go, and that can apply to other HBCUs. I'm just speaking about the number one HBCU.
A little biased, but yes. Okay.
But even, I'm just saying, but truthfully, that empowerment we have when we're surrounded by us, we are the sharpest iron, and we're out there sharpening each other every step of the way. I think it allows us to show up in these spaces. As they say, if there's not a seafood at the table, you make the table, and all those kind of things. And I just always feel like I can be completely myself, and people aren't used to that. I actually have a little bit of a story to go with that. Is even in residency, I trained at one of the top, I would say at the time, probably top 3 to 5 residencies in the country. I had someone advocating for me at the program, but it was not a program that was committed to diversity. I probably was the first Black, and I don't know if Black female or Black, but in a while. I'm not saying they never had one before, but it just wasn't important to them. They just wanted great students, medical students coming to the residency. So I didn't think I was going to go there, because I actually ranked Emory University #1, because a long time ago, even that long ago, with Dr. Sharon Haran, they already had a commitment to diversity in their programs, because they knew how important that was for diversity in training to represent the demographic that they were serving. And they still maintain that commitment to this day. So that's who I had. I just knew that's where I was going. But I said, let me put my residency as #1. I'm going to put Emory 2, because I'm still going to end up at Emory.
Okay.
But I ended up matching at that #1 program, and ended up being the only Black female in the program. My co-residents were great, and I'm going to say I wasn't the best at standardized testing, and they used that against me. I was from Inglewood. I trained in Los Angeles. I had my own friends. So when I didn't go play beach volleyball after shifts, no, serious, this is real. When I didn't go to bars, it got translated into me having a chip on my shoulder. Attitude. And that went on to cause them to put me on a probation. They wanted me to do an extra year of residency.
What?
Absolutely not. And what I will say to Oprah's thing, and something I'll go back to what my mom told me, what Spelman instilled in me, and beyond. My mom told me, always set my expectations higher, because they're always going to be higher than what other people set for you. So that's how I always regarded myself. So when they had these low expectations of me, I set my own parameters. I wrote them what my probation period was going to be like. I submitted it for approval, and they approved it. And now I have to go sit in with faculty and go over all these question banks, and I'm just rattling all the answers. They said, "Why are you here?" I said, "You tell me. You tell me." Because it was very clear. My co-residents rallied behind me. They're like, "This is bullshit. This is racist. This is all." They said it out loud.
They were being true allies.
Yeah, they were my allies in that situation, but it was the perception of my attitude, because you don't know what a Black woman and how she relates to you know what I'm saying? It looked different than all that.
And what does that have to do with my
it got translated into my academic performance.
Oh my God.
My clinical performance. And so that's a little ding. Now it's 20 plus years old, but when I have to apply for stuff, I have to write, I was on probation or academic probation for this, but it was a lot of it was perception. And so that's interesting. So just to the point, tying, both what my mom said to me about setting expectations for yourself. So you're always going to be above what anyone else is going to expect of you. And like I said, and then Spelman was in me to do that. I was like, what? Oh, no. I'm about to write this myself. I know where I'm coming from.
Yes.
To Spelman on a full scholarship for NASA for PhD. I know what's up here, so you're not going to tell me anything different. And
right.
Yeah, so it's just, like I said, it's the unapologetic, being able to stand up for yourself, being able to be confident when you need to in those situations.
Yes. So many things. So first, I think the message that your mom gave you is a message I think so many of us as Black people get, that we have to work twice as hard and have those expectations, right? Which is so important for us to have. It's unfortunate that we have to always do it, but it's true, because we do have to outperform. The other thing is, I was thinking about the ways you advocated for yourself in our Spelman hymn, the part where it says undaunted.
That's what I named my Jeep. I was like, I got a little blue trim on it. And I was like, your name is Undaunted, because you have to I literally named my Jeep. I was like, hey, that's your name. I'm going to get some stuff
Yes.
on it. I'm going to get a little trim on it because it's still to this day, the way you have to push forward, that hymn, it rocks.
Yes. So true. It's so true. And I just want us to emphasize too, undaunted about the fight, yes. We
Mm-hmm.
are strong, yes. And that we acknowledge our own humanity and value our humanity as Black women, that we get hurt
Yes.
and we need time to rest and we
Yes.
need time to heal and we need time to pivot out of environments that don't respect us and value us too. And so I think the part about the resting, the healing, the transitioning out,
Mm-hmm.
even the joy as Black women,
Mm-hmm.
that has been difficult for us. Can we
Mm-hmm.
speak a little bit about that too?
Say it one more time. The
Like,
rest.
why is it that many of us as Black women
Mm-hmm.
have difficulties with embracing rest,
Mm-hmm.
embracing joy? What
Mm-hmm.
I've heard from many Black women is, I'm too busy. I don't have time to rest. I
Mm-hmm.
don't have time for joy. I
Mm-hmm.
got bills to pay. I got
Mm-hmm.
all these things, right?
Yeah.
Or I'm very strong. These people don't bother
Mm-hmm.
me. And I say, okay, I get on some level, we don't want people who are trying to hurt us to
Yeah.
know they're hurting us. I
Mm-hmm.
get that,
Yeah.
right?
Mm-hmm.
But when we're always like this and we're always like fighting and we're always, now we're disconnected from how we really feel and we're
Mm-hmm.
not honoring our own humanity.
Mm-hmm.
So I have different perceptions about why does he think that some of us as Black
Mm-hmm.
women have
Mm-hmm.
difficulties allowing ourselves that we experience pain,
Mm-hmm.
that we need time for joy and we need time for rest.
Mm-hmm.
What is your perception about why as Black women, many of us have that challenge?
Well, I think for one, as Black women, we have to learn how to take the cape off. All right.
True.
Superwoman complex that you can do it all. Because if you're
Say
doing it
that.
all, you're not doing it all great. Something's
Right.
so that I think that's a big one for me. Is just and then to understand, and I say this on my IG, that self-care is not selfish. I think there is a part of us when we think about taking care of ourselves that it's a selfish act, and
Right.
it just isn't. It's actually the most selfless thing that you can do because
True.
again, if you can't show up for yourself, how are you showing up for other people?
True.
And so, and then also like if this try to leave someone. I had a girlfriend of mine, her name is January, and I remember I said, I'm coming to get you. She has 3 kids. I was like, you got a whole husband. I said, your kids are not gonna die. I got her. We went to a resort, spa day. We road
Ooh.
tripped up to Vegas. She
Ooh.
only can tolerate like 48 hours. But then I was like, look, they're still alive. You know what I'm saying?
Yeah.
Like, allow other people to take something off of your plate. It's
Yes.
okay, you know?
Yes.
And then also learning how to ask. And that's something I had to work on. We get afraid of people letting us down when you
True.
want to transfer responsibilities. And I had to, like I said, I've learned that more recently. Like I had to do this exercise where I practiced yesterday with my nephew. I was like, my water bottle was empty. And I was like, practice asking. Instead of me getting up and filling my own water, I said, nephew, can you go fill my water bottle for me? You know, and it's little small things like that that we have to learn how to ask for help so that we
Yes.
can make room for, like you said, that joy and that
Yes.
rest and that healing. And I just think,
Yes.
sometimes we think we have to do it all or our way is the one way to do it. And I'm like, if the clothes get folded crazy, they fold it.
Right.
We can
Right. They're all not going to come apart. Yes.
sometimes
Yes.
just to let go, I think,
True.
certain things
True.
in order to give yourself room, like I said, for that self-care.
True. And I'm wondering if part of that might be even a trauma response too. Just as Black women, sometimes we become over controlled about things because there's so many things that we cannot control in our reality and our existence. So then we become overly controlled, or I'm the only one who could do that. And then we step into that trope of, I got to be a strong Black woman all the time in every area of my life. Right.
Yeah, or one, I would say this is for me, like not wanting to be disappointed. I think, and if that's a trauma response or not, because I'm not a psychologist, but you don't
You're anticipating.
you don't set expectations because you don't want to be disappointed, right? So I think that could be one too. So that's another reason why you might hold on and stay in control. Just because if you let it go and it doesn't happen,
True.
doesn't see
you
that
can't be totally disappointed, devastated.
So instead of waiting to see if someone's going to recognize that you need this help, you're just going to keep it
Yeah.
yourself, so you don't have to now be disappointed in your partner or
Yeah.
your children or whoever that
Mhm.
they don't see that I even have this need. So you
Yeah.
don't give space for seeing that. I don't know if
Yeah.
that makes sense, but
Yeah, it's like it's maladaptive coping, basically,
Mhm, mhm,
right? So it's my way to kind of just manage going through the world and just manage doing everything because
mhm,
I've convinced myself that so many people are going to disappoint me. I anticipate it now. So
mhm,
now I step into this role, which is very unhelpful for us. So what I'm hearing from you is that we as Black women need to say, okay, if I can't totally burn the cape, if I can't totally burn that, can I put it down for a little bit?
mhm,
Right?
mhm,
Your friend was able to go with you. She was able to have fun.
mhm.
Everything was okay. Everything was okay. So something else, I'm gonna say one more thing about Spelman and we're gonna turn it down. Okay. So something else through Spelman that I have appreciated is learning about and valuing the power of sisterhood. So
Mhm.
you talked about ways that you've had Black women around you. I've talked about the power of sisterhood. What I've also heard from Black women, particularly in the workplace, I hear this quite a bit, and people ask me, can you talk about this? Can you talk about it? I've done a number of videos about it. I will continue to do more videos about it, where they talk about all skin folk and kinfolk, where they
Mhm.
talk about other Black women in the workplace have
Mm.
actually been the workplace bully or have
Mhm.
been very cruel to them in the workplace.
Mhm.
And so my message to them is I understand that, right?
Mhm.
Because hurt people hurt people. I'm not condoning the behavior, right?
Mhm.
But I also recognize that those people are hurting, right? I also want Black women to not jump into all Black women are that way because we're not that way. So, what would you say to some Black women who say, "Well, I can't trust Black women because every job I go to, it's the Black woman who's doing something mean to me."
I'm not sure. I've not experienced that, thankfully. In terms of, I understand that that can be a issue. I did witness some of that. Like I will say, at Spelman, everyone did fit into that sisterhood,
Mhm.
where we're like, why not? It's so great, But everyone doesn't come into the fold. I would just, obviously that none of that should be tolerated. Again, no matter who it's coming from, regardless of race, gender, or anything like that. I don't think any of that should be tolerated in a work environment. So,
Mhm.
I would just say speak up. But like I said,
Yeah.
for me, I'm fortunate to have not experienced like a bullying, or we've been very supportive in most of my work spaces.
Yeah. So for us not to generalize, right? Even if that's you've had several experiences, let's not generalize to that.
Mhm.
So, Dr. Yana, Dr. Herbert, can you share with the audience how did you transition? So you left the job you were at for 18 years.
Mhm.
What did that pivot look like? How did you pivot?
So, like I said, I was already kind of pulling back, and I was balancing it with other jobs. So I worked in Texas, like just a few shifts. I would pick up shifts on a Native American reservation, and this is how I knew that other environments weren't the same. Patients were just as sick, but it wasn't the same in terms of
Mm,
staffing and different roles. And so when I took my leave of absence, I replaced the hours out of state, actually. And I was like, it's a
mm,
shame for my mental health. I got to travel, but I'll travel for my mental health.
okay. Okay.
And so I tested and I said, let me check in with my loved ones. Let me check in with my sister. Let me check in with my nieces and nephews. Let me check in my personal life to make sure it's not adversely affecting those things. But what it
Mhm.
gave me the freedom, because now what it is I only go out of state. I only work part time now. But what I did was figure out a way to work smarter and not harder. So I
Good.
secured jobs that made my time worth more so I
Mm,
could work less. And it gave
perfect.
me the opportunity to pursue other endeavors. And when I spoke earlier in the segment, is that it's allowing me to get on the other side of care. So now I'm able to pursue, kind of business or entrepreneurial endeavors.
Mhm.
And that's what you see on the screen with Path Health. So when I'm off, I work the part time. I'm able to work in my business and start building something that you said like brings me joy and hopefully brings preventive and healing to women. And I will say this, as Black women and as Black women physicians, we still do have, it's not a burden. I look at it as a responsibility to still stand in the gap one thing that I'll say is that even if you're insured, there's still health disparities, right? There's still things out there that we have to get in the middle of. And so that's what, I want to do. Even though there's focused areas of my practice, they're the ones that will prevent chronic diseases. There are treatments that decrease all-cause mortality when we're talking about treating obesity, when we're talking about treating perimenopause and menopause symptoms. When those things are there, that's going to make it that I never have to see you in my emergency room. That's how I look at it. If we are not diabetic, if we're not having cardiovascular disease, if we're not falling and breaking hips, I don't ever have to meet you when I'm in my ER scrubs.
Right.
We're going to be just doing preventative stuff. We're going to be controlling symptoms on the other side. And so I have the freedom to do that and to take that risk and to bet on myself, at this stage of life and see how it goes. So that's the pivot that I made. Like I said, I started with a leave of absence, shift my hours, made my time worth more to open up space for me to try something new that and to be able to interact with women, especially African American women, in a way where you get to sit, you get to listen, you get to give input and treatment plans that matter and make a difference. That's not the kind of time I have, obviously, in the ER setting.
Right.
So that's going to bring me as a joy and prolong my career in medicine as well, because the truth is, like, in medicine, suicide rates are high. Burnout is high. I think we're at the top of the list now, ER physicians, for things like that. And this is real. And people don't understand it. And and that's why you have to protect you. We only get this one life.
That is scary. Why is that the rates are so high for emergency medical?
I think it's just the burnout, the demands. There's a lot of moral injury in the specialty. Physicians aren't respected anymore. I don't know a different way to say it. Like, you get yelled at, cussed at, you don't have control to do always the right thing for the patients based on resources. I think there's a part of you also knows that you only have them in that short window of time. If I say discharge and follow up with their primary care, there's no appointment for another 3 to 6 months. Can't afford it's just so many factors that
it's so much high stress. Yeah. And the way people are responding to you. Yes.
The stress. And like I said, and everyone's personality is different. I always say 2 people go in the ER. You have high strung people go in the ER and real chill people like me that go in the ER. But it's still, like as Emma said, you can quietly be absorbing it, even if you're strong on the outside, even if you're the person who rolls off your back and you're easygoing. But it's stress nonetheless. The burnout is there, and the burnout is happening early and earlier in our careers. More and more physicians are looking for exit strategies younger and younger. And I think that's across the board. Like I said, I'm in these groups and side hustles are amok. Everyone's looking for how else do I leverage
the highest level of education. Wow.
Oh yeah. Healthcare isn't what it used to be, unfortunately. But I always say, if it's in your heart to do it and in your heart to serve, and there's nothing else that you can picture yourself doing, still do it. But take these little hints of controlling and being in control of where you land.
Yes, so important. And think about first work-life balance. Think about all the things we talked about in this discussion. So if there's because you said it's happening now early in the career, right? So if there's an early career Black woman medical doctor and she's starting to experience burnout, what would you say to her?
I would say first try to see if it's the environment, because oftentimes some people just make a switch at the hospital, make a switch of their practice, their group, and that it goes away. That often happens. But like you said, people have to have the courage to leave. That's the big thing. There's a lot of young Black female physicians that came into where I was already in double digits, and they weren't a fit. You could tell it just wasn't good. I said, you don't have to stay here. I said, get out now while you're under 1 year and you're not feeling obligated. Find your options. I would encourage people to leave if it wasn't a fit, and go until you're happy, and obviously I wasn't at the point in my career where I was, feeling what I was feeling. I was, I was fine in those moments, and I functioned well, but I would tell them, I said, if you're not getting along with the nurses or this one isn't a fit,
Mm-hmm.
go take the other job, take the other offer.
Yeah,
You know?
yeah.
And
Because
it's
you got the
okay.
credentials, you got the experience,
It's
right?
okay. Some
Yeah.
women do locums, but I would say the first thing I would test is the environment, because oftentimes a simple switch of the where, whether it's the colleagues or the operations of a hospital can make a very big difference.
Yeah,
Just the support that you have, like I said, because medicine is going to be medicine most places
yeah.
you go. So they still really have that passion. You can consider, depending on specialty, being in control, opening up your own practice, can be an environment, that you are in control of. You are the leader. You dictate the culture. You
Mm-hmm.
you pick the good team. You train them. That is another way. That's the state I'm in right now. Right, I'm starting a new practice. So when I am going to grow and build my staff, I have to be very careful about the culture that I establish in that's my space.
Right. That's your, yeah.
My own place and not be at peace. So I
Yes.
would say that is another option. Then from there, like leveraging your MD. Sometimes you don't always have to be on the clinical side of medicine in order to have a rewarding career, and that could be a variety of things. But yeah.
That there's options, basically. We have to remember options, 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 options. So as we're winding down, and if there's a Black woman, it could be a medical doctor, it could be just a Black woman in general, and she's listening to this conversation, she could resonate with anything that we've discussed. What words of wisdom could you offer to her, or can you offer to her?
Words of wisdom, just where I've landed. I just always say, you only get one life. Be happy. It's
True.
me. It's that simple. Be happy. Life is too short. Directly, like I said, in medicine, find environments that support you and that don't be the trail. You don't have to be the trailblazer. I actually am a mentor in Elevate Med, another Spelmanite, founded that, Alex Porter Umphrey, and my mentee currently is a fourth year medical school stellar student. She has all the options. We're trying to we were narrowing down her match list a couple weeks ago. I said, you don't have to force any, square pegs into round holes here. You are smart. You can do what because she wants to do, research. She wants to do things that reflect the underserved community. She wants to be in community. I said, you have so many options, so you don't have to make exceptions, for anything, not even in your training, the way, and I'm not saying I made an exception in my training, but what I went through, she doesn't have to go through if she already can identify a program that celebrates diversity, that's not going to just dump a DEI just off of, what I'm saying? Like, go where it's sincere, where it's authentic, where you are wanted, where you can serve. If your calling is to serve a certain demographic, still have certain standards about your workplace the best you can, or whatever. But I mean, I know we can't control all that with,
Right.
the way medicine has shifted, but those are the things. And then, like I said, recognize when it's not right, and just don't be afraid to make a pivot. I've learned in the late.
Pivot. We can move, Black women. Like, we've always moved. We can always move. Yes, pivot, pivot. So as we're winding down, can you please share with the audience about your practice,
Sure.
services that you offer, and the best ways for you to be contacted?
Yes. So again, I am the founder of Path Health. It is a boutique wellness practice in the heart of Atlanta in Buckhead, where our primary services are medical weight loss, as well as bioidentical hormone replacement therapy for women in their sometimes 30s, but 40s and 50s. We want to be a resource for African American females because we want to stand in that gap, not only from the standpoint of education, but as a standpoint for resources and community. And adjunctively, we also provide IV and IM therapy. And you can reach us on IG at, I'd say the @ symbol PATH, PATH, Health ATL. And then my personal IG is at Dr.Ayana MD, and I pretty much cross post. So you follow one, you're following both, but I would love a follow if you have a chance.
Okay, so everybody, I'll put all her information on YouTube. I'll put in the description section so you can check her out. And I love, 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 love everything you said. Particularly what I really appreciated what you talked about is now You have options where you're working smarter, not harder, right? You
Yeah.
also talked about multiple streams of income, which
Mhm.
is so important for us as Black women. I talk about that when I was at that toxic job, I only had one stream of income. That's why it was so scary to leave. But
Mhm.
now that I've left, I have multiple streams of income. And I love to share with Black women about how to create multiple streams of income.
Yeah.
So everybody go to Job Liberation Summit if you're trying to find ways about creating multiple streams of income. That's one thing we're going to be talking about, but so much more. So you get on the waiting list. It's May 16th to 18th, and I'm going to have all the information you'll see on the waiting list. But just in terms of the speakers, we have Stephanie Perry, Alicia Renice, Rashida Dow, our Black Utopia, Glam Mazzini, Black Sit Global. It's so many. It's so many. I can't even say. It's so many Black women, brilliant Black women. So you need to come to the Job Liberation Virtual Summit. Let me also say, as a privacy consideration, your name will not be listed anywhere. Because I know it's Black women like, oh, who's gonna know who's in my business? Okay,
Mhm.
nobody's gonna know. Okay, nobody's gonna know about you trying to pivot and get your exit plan together, and you will not be on camera. Okay, so that's one thing I want to announce. And then the other thing, and I'm going to put I see a request. Can you put your IGs in the chat? I have it in the description section. But Dr. Herbert, can you put it in the chat as well?
Sure.
And then I also want to share with everyone that I just launched my Butterfly YouTube membership for Black women. So when we talk about sisterhood and community, this is a place for us to come together for us to support one another. Okay. So the YouTube community is for Black women, and it's $2.99 a month. I want to be clear about that because people are like, oh, well, how much money is it? It's $2.99 a month. Okay. Well, we have monthly check-ins, we'll have guest speakers, and so much more. So check out again in the chat. There's information about Dr. Herbert's IG. Again, I'll put all of her other information in the description section. So check it out. And okay, I'm going to so her information for, let's put it here too. So I'll have her LinkedIn, I'll have her information for, I'm sorry, I'm trying to multitask. I'll have her IG. Okay, so this is one of her IGs. And then I'm going to put her other IG and then her LinkedIn. Okay. But then again, I'll have all this information for you in the description section of the video. I will also have the information going across the screen about the waiting list for the Job Liberation Virtual Summit for Black women. And then I also have a description section how to join the YouTube membership community, the Butterfly YouTube membership community for Black women. So let me just pull up her last one for her LinkedIn. Okay. So everyone, I'm going to read the community chat because I believe in sisterhood. Okay. I believe in community. So I want to give honor to our community and just acknowledge our comments that are coming in. And I've been trying to respond to comments a little bit better this time in real time. It's hard for me. I'm multitasking, okay? But I'm trying my best to do it in real time. So let me read some of the comments and then we're going to start winding down, okay? So let me see. Okay, so they're saying hello to us. And I see my guest from 2 weeks ago, Danielle, who's a nurse. Hello, Danielle. Greetings, sisters. Welcome to another evening of learning, creating, sharing, and caring together. Yes, so true. We've made some comments before about one of the physicians having a similar experience. One of your friends, I think, is here, Lauren Powers.
Yes.
So one of your friends? Okay, so she's
also
here.
Spelmanite.
Oh, okay. Hey, sis. Okay. Let's see. I feel the same way about my job, dread and heaviness every workday, lack of support outside of my role. And sis, again, based on what we talked about, we understand that experience and we wanted you to know that there's options. You're seeing me, you see Dr. Herbert. Both of us have pivoted from situations and we're doing very well. Now, the job could be toxic like I had, or it might be, you know what, this is just not the place for me. Okay. But whatever that might be, We want you to know about your options and how to pivot. Not just go do it, girl.
Mm-hmm.
We're telling you how to pivot. Okay. Thank you for discussion. Good for you. Oh, go you. No ticket tape. No ticket tape parade about you leaving. RVUs. I think that was that a question. RVUs. Is that a question?
So
You know
that's
that?
probably talking about some of the metrics that we have to face
Oh,
with,
right.
productivity, all
Okay.
that.
Ugh, boo hiss. Okay. I'm so proud, preach. I'm so proud of Dr. Herbert. There are too many docs that are miserable. In my 50s, I'm transitioning to working in a new way and no longer in the emergency room. Wow. I'm so happy. I'm sorry to hear about your experiences. I'm happy and encouraged and happy for you just about the possibilities of what's coming next for you because you are making that courageous step to pivot, right? The hope is that you're getting resources, though, that you
Mm-hmm.
pivot in a constructive way. Let's see, we lie to ourselves for sure. We feel like we are strong and can push through, though. Yeah, that is a lie. That is a lie to ourselves. And somebody said this earlier, and I completely agree. That mentality and a lot of things we've been talking about, the roadblocks, the mindset issues, that is fruit of the slavery tree,
Mm.
right? That is fruit of the slavery tree when we say, I can't lead this place or whatever. And one of our Spelman sisters, Dr. Monica Cox, she actually said, you know what? We have to be mindful. We don't own these plantations. Some of these jobs are like plantations. We don't own it.
Oh yeah, if you quit, that thing gonna keep going. You're just a cog in the wheel. I think also
Exactly.
realizing that, realizing you're a cog in the wheel in this system, and you don't have to be. Like I said, you can own your own if that's what you choose. But yeah, so I just realized I was like, if I'm like, ER's open 24 hours, 7 days a week.
Yeah. You
Watch how
leave this, I'm going to
watch
break
how
the
quickly
bank.
you'll be replaced.
Right, right. I've heard Black women say, if I leave this job, it's gonna fall apart. Or if I leave this job, they're gonna shut their doors. No, they're not, sis. They're gonna keep going. Okay, you lying to yourself. Don't say that. And don't say to yourself, I did this too. I'm be honest, I did this. I want to kick myself in the butt. I did it, but I did it. Oh, I bring so much to this organization. They wouldn't want me to go. They could care less, honestly. I mean, some of these organizations could really care less. Let's say I grew surviving and looking at the clock. Facts. Okay, we talked about that one. Let's see. We are taught by our families to kind of stick it out, right, with our well-being. Absolutely. Let's see. Let's see. It's so weird how they weaponize anything, right? We talk about fruit of slavery tree. We had to be mules and ignore our feelings. We're not going to do that anymore, right? They have done that to us and made us believe that, but we're taking our power back as Black women. We're not doing that. We're not being people's mules, okay? We are serving and doing these things for ourselves because we deserve better. We do, okay? Join late to the great conversation, watch the replay. Okay, good. And make sure everybody give this video a thumbs up so that YouTube knows to suggest this video to other Black women who might be in a similar situation. And also, please share this video, okay? Glad you're doing that. We talk about disparities. Yes. Okay. Because when we call out disparities in quality care in certain environments we work in, we become a target and we will have to leave. Wow, that's a good point. That's a good point. You want to say something about that, Dr. Herbert?
I can understand. I hear stories like that when you do speak up. When you bark too loud, if you will, then you're starting to rock a boat, if you will, and you become a problem. You become a liability to that system. So I definitely can relate to what she's saying. So it's like you almost it is that kind of thing. Or if there is a problem, and you have so few resources to make a change, you almost don't want to speak up because now you're the chair, the president, and everything else of that committee.
Right.
The problem and now you're just putting something else on you that no one else wants to solve. So sometimes that kind of quiets our voice as well because you're going to be it, right?
Yeah. Yeah. So
You're
there's
the
a cost. There's a
Yes,
cost.
yeah, there's a cost.
Yeah. So be mindful of the cost and make sure you take care of yourself at the same time, right? I see from one of our members, it's an amazing discussion. Thank you, sis. Oh, flutter, flutter. Yes, girl, I believe in butterflies. I love butterflies because butterflies symbolize transformation, metamorphosis, right? And my community. The hope is that this YouTube community, my YouTube membership community, the summit that I'm doing, all these things our safe cocoon for us as Black women so that we can come together and heal, uplift, and learn from one another, okay? So let's see. Oh, that's right. Tatiana was talking about numbers. She got it, RVUs. Let me find out where you worked at a big HMO healthcare provider that I also work for. So true. More emphasis on revenue versus quality of patient care. Yeah, and I think that happens so much across all professions that there's this focus more so on the bottom line, and but no matter who they're, I guess, I don't know, terrorizing of their employees as they're trying to get all this money, 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 right? So everyone, thank you so much for watching today. I'm so thankful for my Spelman sister, Dr. Herbert, who joined us today. Yes, and shared so much wonderful information with us. So I'm going to give you the last word, Dr. Herbert, before we wind down.
Well, I guess the last word is just, like I said, be true to self. I did want to slip one other thing from a question you asked earlier is, as you do these careers, you stay in control by living under your means. So like you said, the golden handcuffs. So just, the multiple streams, money management, things like that. So you never feel like you don't have a choice because of salary caps or anything like that. You can lateralize. But yeah, I just say, like I said, I'm going to say it again. We get this one life. Be happy.
So true. And we can pivot. Ladies, we can pivot. And again, as we get ready to pivot, we got so many resources for you, right? When I was out there trying to pivot, I had to do it on my own, okay? I don't want you to be doing it on your own. I don't want you doing that because it's exhausting, it's stressful, it's scary to try to do it on your own, okay?
So don't be afraid to build even the team while you're building, if that makes sense.
True.
Whether it's a business advisor, a coach, or anything like that, because the returns on that investment, you cannot really put value to that. And it actually accelerates you faster than, but be careful who you choose. Don't trust everybody.
Do your research.
Trust but verify and all that good stuff. But it'll get you, when you put the right people around you, and who you surround yourself with, people who are going to support you. I think that's an important thing, so that you stay encouraged, because it's going to get discouraged. It's going to get hard sometimes, but you have people who uplift you, who can see the same vision that you do, who believe in you. That's who you want to continue to surround yourself with.
So true. So true. So again, all of Dr. Herbert's information in the description section. Get on the waiting list for the Job Liberation Virtual Summit for Black Women, May 16th to 18th. Join the YouTube community for Black women, which is my community, for us as Black women, for us a safe space, for us to hold space for one another, uplift one another, and to learn from one another. Again, all the information in the description section. And I will see you all later. Take care, everyone. Bye-bye.